Welcome to HAE 605. We're going to discuss anorexia nervosa and bone density. Okay, so the objective for this learning outcome for today is that we're going to discuss the risk factors for anorexia nervosa, and then we're going to discuss how the disorder affects the body in various parts of the body. We're going to describe the changes in the normal bone development for a healthy person or for a person that has a disorder. And then we also going to compare what treatment works best according to the patient. And then after that, we're going to explain the importance of how knowledgeable a technologist should be in concerning this disorder versus the treatment. Okay, we're going to give you a little background about anorexia nervosa. So this is kind of like a mental disorder. And what it does, the brain tells the body that something is going on when it's actually not. So majority of the time, it tells a patient that they're big when they're actually not. So if you ever think about Will Smith's son, like now, he's have this disorder where it determining his weight and versus how he looks versus this abnormality. Okay, this eating disorder falls in a group of affected patient because it's based on your age or whatever stage that you have it in. So you can have a crease, or you can have a mild, or so it's different level of the stage, and it's according to your age. Nutrition is a vital part of this disorder because the body has to have a certain amount of nutrition to have a healthy body. So if you have healthy nutrition, if you're eating the proper foods or having the proper things that you have, then you create better quality of life. But if you're not having the nutrition that your body needs, so it's almost like you starving your body. And so, but with the nutrition, it don't always just start when you would, as a pediatric, it can also start in the womb of a mother. Some of the risk factors around this disorder, like we were saying previously about the nutrition, the body needs certain nutrients to have healthy bones. And if you don't have certain vitamins or enough vitamins, it causes the body to create problems. And it depends on your age, your stage, and what sex you are. And so just say for instance about vitamin C. Vitamin C, if children, pediatrics don't have enough vitamin C in the body, it develops what you call scurry. And what this is, it causes inflammation around the joints and causes the kids to be in a lot of pain. Even with vitamin D is, if you don't have enough, it can cause rickets. And if you ever see when kids develop, that you be walking around and you see they got like all silver caps in their mouth, and it's because they don't have the proper vitamin D. And what the doctor does, the dentist does, they put caps on them, and then give them the proper nutrients that they have, give them extra vitamin D. So when their primary teeth fall out, then their secondary teeth will come back strong with the proper vitamin D. And then with vitamin A, it interferes with the development of the bones, and then you go from your pediatric to transition to the teenage and to the older adults. And sometimes if you don't have enough vitamin D, it can cause kidney damage. You could be nausea, fatigue, just all kind of different things. And with vitamin A, right, it can even cause like night blindness, and it can also cause hair loss. It can cause nausea, just like if you don't have vitamin D. It can, you can have birth defects. You can have a lot of headaches due to the fact that you don't have enough vitamin A. Even with the vitamin C, like we was talking about before, in infants, it causes pains in the joint, but like in children or older adults, it makes you prone to a fracture if your bone's not strong enough. And so majority of the times, development on what age you are and whether you're a male or a female is determined how this affect what risk factor is for anorexia nervosa. Okay, so not only does the disorder affects the mind, it affects different things. Like just say for instance the brain. With the brain, it causes you to be moody. It causes you to not think properly. It tells the body something wrong when it's really not. Like I was telling you before, it makes you, the brain tells you that you're fat, but you're really not fat. But it's coming from the disorder, even with your hair. Like how Joshua hair is. Most of the time your hair be like really, really thin. You know, patches coming out be like real brittle, easy to break. Even with your intestines. You know, it's hard for you to use the bathroom. You become constipated. Sometimes you feel bloated with your blood. You know, you can develop anemia, which causes you to be cold all the time. You have to take iron pills. And even with the hormones, right, it affects males and females different. Because with females, it can cause you not to have a child. Or it can cause you to become pregnant, but you won't hold the baby. It'll cause you to have miscarriages. And then for women that do carry children long term, it causes the baby to be extremely small, like underweight. And then even with your skin, it makes your skin look like it's dry all the time. It makes it look scaly. You know, like if y'all know my friend Wood, he just like he peels all the time. It just come from, it just look like it's your skin like different colors or whatever. Even to cause you to bruise real quickly. Okay, so the changes with this disorder, right? It attacks the body according to your age. Just take an instance, if you're young, the bones grow differently according to your age, right? So with the pediatric, it don't affect them as bad because they're still growing, but for some reason it attacks 15 to 18 years old worse than the pediatrics or the older patients. It's because within that transition, it can cause a lot of harm that affects your quality of life for the rest of your life. Okay, so the treatment options, like I was saying before, is that it varies, right? And so, like, if you have like a small, like if you don't have like if you just don't have the real loss of weight, if you don't just look, like all the way bad, well then you can just cut back on some of the things that you're doing. Like if you was a adult, well you can just stop drinking, or you can just stop smoking, and then it'll boost your bone structure up. But if you got like a mild case, what they do is they give you opposite, like just say for instance, if you liking vitamin C, well then they'll give you vitamin C supplement. If you liking vitamin A or vitamin D, then they give you A or D supplements. So whatever you liking, they just give you the supplements to reverse what it is that you have going on. And then with the older patients that has osteoporosis, right, they give them, according to whether or not they're male or female. So if it's a female, they give them hormone therapy for women. So they give them therapy and they give them more estrogen for the women. And then if it's a male, then they give more testosterone because to balance their hormones back out. But if you didn't get to the point where you suffering from this disorder, you have to use a combination of things. So it depends on your age, like we said before. Then it depends on your sickness. So if you 18 years old and then you suffering from this disorder, where then they'll give you multiple, like if you suffer from both A and D, well then they'll give you A and D, and then you have to have some type of psychological treatment to go along with it. But if you are older patient and you suffer from this disorder, majority of the time you already have osteoporosis. So they'll give you a hormone therapy, and they'll give you the additional supplements that you need. So it just varies on whether your age, whether you're a female, versus sex, and then what stage of life you're in, whether you're in a pediatric or the transition between the teenage or the older life, depends on your treatment. Okay, so the importance of the bone density technology and this disorder and how to monitor it all goes back to how knowledgeable the technology is. The technology should be well rounded about each stage. The technology should know what the bones should look like for a normal pediatric patient, what the bone structure should look like for a teenage from 13 to 18, what the bone structure should look like for older adults. So that's one piece. And then the technology should be well rounded of what study or what test of bone density should be done according to the age, according to the sex, right? And then the other thing is the comparison piece. You know, them being knowledgeable on the disorder versus the age or the sex. So that's another piece that they should be knowledgeable on, and that'll help assess the situation. Okay, so the conclusion is, you know, we got a well-versed of how this disorder, the risk factors, right? How the nutrition with the nutrients that the body needs to have a healthy body and healthy bones, and if you're starving your body, what that looks like, and what it does to various parts of what it does to the brain, what it does to the intestine, what it does to the kidney. So you kind of like well versed on, you know, what's going on with the body. Then we discussed how you treat sex is different. You know, what you do for somebody that has osteoporosis, that's a male, it's different from what you do if it's female. And then the last part is the technologies knowing the different developments of the bone, the different development of the age, and how you give treatment according to this study. So kind of like a whole view. But do you guys have any questions?
I have a question, Ms. Thomas. What are the risks of anorexia nervosa?
Well, I can answer that for you. One of the risks for this particular disorder is the lack of vitamin C. And so it causes your body to lead to scurvy, and your body has trouble fighting off different infections.
That's right. That's exactly right. Because I was in the first slide dealing with the lack of vitamin C. That's exactly a smart girl.
I have a question. What are the effects to your body due to this disorder?
Oh, I know one. One of the risks of these effects of disorder is dealing with your hair. It could be brittle, thin, cause your hair to fall out, patches in your head.
Oh, so that means you guys are paying attention. That's very, very good. Well, since I think, you know, you kind of like got a way around. So I made some cards here. And so with these cards is what the, how the disorder affect each part of the body. And so I'm going to give you the cards, and I'm going to see how well do you recall how it affects each body part.
Okay, so I guess you pick a card.
Okay, what are the risks of your hair?
Your hair is thin and brittle and breaks off.
Your hair is great.
Pick a card.
What are the effects of your intestines?
The effects on your intestines are constipation.
That's great.
Okay, what are the effects of your kidneys?
Your kidneys fail, causes kidney failure.
That is correct. Okay, your card.
What are the effects of your skin?
The effects of your skin are discoloration and dryness.
Okay, that's true. Correct.
Okay. What are the effects of your brain?
Moods causes you to be moody, very moody.
That is correct. And
And what is the effect of your heart?
the effects of your heart is heart failure.
And that is correct.
Okay. So I see you guys. Y'all pretty much y'all got the learning outcome, and y'all did very well. Class is over.